Hello, everybody. My name is Josie Quintanilla,
And I'm Brandon Fonseca.
and our presentation is on,
Generalized anxiety disorder, otherwise known as GAD.
and this is for Social Work 679, Psychopathology. Okay, so a little general description on generalized anxiety disorder. Some people also call it GAD or GAD, and it's part of the most common psychological disorders here in the US, which are the anxiety disorders. And so, if we can characterize generalized anxiety disorder into just a few words, it is excessive worry and extreme fear related to nothing really specifically, but a lot of things that are out of your control. People who have this disorder happen to worry a lot about their family and something happening to their family, or especially right now during COVID times, a lot of like um, fear and even a little bit of like obsessive thoughts about obtaining the virus, like getting the virus or being infected or their family being infected, you know. So it's just anything that is they feel is out of their control. It can bother them, and even it could even just impair their overall functioning. And so currently, the percentage of American adults that have it is about 3.1%. And so it typically starts around either adolescence or early adulthood. And Brandon, I don't know if you want to add something else.
Sure. So a comorbid diagnosis is common. Comorbid just means co-occurring, so nothing crazy. Um, but it does mean that you have another diagnosis going on. So that can be depression, OCD, schizophrenia, bipolar, different natures. It's nothing bad, just something to be aware of. Doesn't mean you're any different or anything, just means you might need a little extra help, and that's okay.
Yeah, so there can be co-occurring diagnoses, as Brandon said, but the most common ones are depression and all the different types of anxiety, which can be OCD, panic disorder, and stuff like that. So they're commonly linked together. So what does GAD look like on a daily? So a lot of people may think that psychological disorders are only something in the brain or in their thoughts, but it is such a physical, like there's so many physical symptoms that come along with it. So some of the physical symptoms that I can talk about are chest pain, just always feeling a lot of anxiety, feeling that pressure in your chest, feeling like you can't really breathe. Also, having trouble sleeping, not staying awake. You fall asleep, but you continue to wake up. Restlessness in class, your mind goes blank, you can't concentrate. But there's also a lot of jaw clenching and different types of um, pains in your body due to tension.
And then, as Josie had previously kind of touched upon a little bit earlier, the psychological symptoms tend to look like excessive worry, irritability, persistent anxiety, and fatigue. And exactly as she said before, that excessive worry just mainly it's things that are not necessarily in our control. In order to receive the diagnosis under the DSM, uh, 5 specifically, you have to have symptoms on most days than not, and they're at least 6 months.
Yes. So generalized anxiety feels like a lack of control. You can't control what's going on. And it can be so severe to the point where it impairs your ability to function daily at work or at school, you know, having fear of going to work because you know or you feel that your boss is going to fire you today, or having fear of going to school because there's going to be a school shooter today, you know, things like that, which sometimes they are like the thought stems from something realistic, but they kind of overestimate the threat.
So some of the treatment approaches that we can look at, one of the most common ones was CBT, or cognitive behavioral therapy. That looks like restructuring of behaviors and thoughts. And the other one is MICBT, or motivational interviewing. So that kind of looks like it's pretty self-explanatory. Sympathizing and empathizing with an individual, as well as encouraging them and looking at their strengths and helping realize their own strengths. In addition to that, cognitive behavioral therapies, changing those thoughts and behavioral patterns to teach them how to cope and move forward with their everyday lives. One of the less common was emotional regulation therapy, and that one is research. But emotional regulation therapy is just teaching people how to cope when the emotions become too much for them in their everyday lives, and teaching them how to calm down and ground themselves. But definitely, cognitive behavioral therapy is one of the most common and most famous approaches utilized in mental health today. And it's also been found to be most impactful when added with a medication.
Okay, so medication, there is a plethora, there's like a huge variety of medications that a doctor may prescribe people depending on either co-occurring diagnosis or existing medical conditions and stuff. But the most common type of medication that will be given to a GAD patient are antidepressants. So either selective serotonin reuptake inhibitors, or norepinephrine. And so these antidepressants, they target the chemicals in your brain, the serotonin and stuff like that. And so they definitely do a lot more of like your nervous system and stuff. And so that's like the first line, the first choice of medications that the psychiatrists or doctors may go to. But the second in line are the benzodiazepines, which is commonly one of the benzos that is most common is known as Xanax. So Xanax, on the other hand, is designed to deal a lot more with it just relaxes and calms you. So it deals with the somatic symptoms mainly. And so benzodiazepines, they can become addicting because people become either like tolerant to them, or they just really enjoy feeling calm. Like when you have anxiety, it's this consistent and persistent worry, and just feeling like your thoughts are so fast and everything. And when you have a benzo, it's just like a fresh dose of like just air, air, and everything that you need to survive is just calm. So for that reason, benzos are a controlled substance because they are addictive, and they're also sold. I know you guys may be aware about this whole like, um, how common it is now for a lot of youth to be abusing Xanax, even using Xanax, obtaining it illegally, and even abusing it. So medication is not a one size fits all. Neither is psychotherapy. None of these are a one size fits all. Medication is like a trial and error process. There's a lot of adverse effects that can come from medication, such as nausea, vomiting, um, restless leg syndrome, insomnia. So sometimes people just want to cut the medication or not give it a fair try because of these adverse effects and stuff, or they just feel that they don't work for them. Like the adverse effects weigh out the anxiety for them. So Brandon, I don't know if you wanted to mention anything else about regarding medication and.
One of the studies did find that so yes, not one size is not fit all. However, we do study the approaches to know what has the most common and best effects on clients or patients. That being so, we use those as a front line before we have to move to something else, in hopes that we have to minimize that trial and error. And the same goes with antidepressants. One of the biggest findings that we found was in high dosage SSRIs, it was more effective than low dosage SSRIs or SNRIs.
Okay. So the goals of treatment, I guess if it was summarized, the goal is to reduce the symptoms, so reduce the persistent worrying that, you know, can overtake your mind, but also the physical symptoms, which don't allow you to breathe correctly, that don't that mess with your digestion, that mess with your ability to sleep. And so we want to reduce those negative symptoms, and we want to restore the ability to function.
So the biggest, I would say the biggest goal is anything, the definition of a disorder is when you lose functionality in your life, or when even though you can be functioning, sometimes it's too much and then eventually you end up crashing. Um, and the biggest thing is to help the client restore a healthy functionality in their life.
Mhm. So people who suffer from generalized anxiety disorder, it happens to be about two out of three of them happen to be women. So women are a lot more prone to having this disorder.
Um, the other issue is that we found in the research that we utilized that while there is a comorbid diagnosis, women are more likely to have a depression diagnosis, while men are more likely to have a substance abuse related diagnosis.
Yes. Environmental conditions and risk factors. So the studies and research that we did, they've shown that many of the people who have this disorder, they've had a troubled childhood, or they've had like a significant event, something like that, a divorce, a death, you know, sexual assault, something like that happened to them early on in life. And so it just shows that, like, you know, developmental disturbances during, you know, your childhood and your adolescence, it can contribute to that. And traumatic experiences, like I said, death, divorce, illnesses, and it can be associated with the increased anxiety and anxiety sensitivity.
Ironically, in the DSM, when we looked at environmental disorders, I mean, environmental conditions and risk factors, the DSM mentioned, as my colleague said, uh, however, it doesn't specify as to any like specific risk factors other than like, you know, in childhood, there's a traumatic event, or even a traumatic event, or there are like the helicopter parents, for lack of a better term, or overbearing parents as well, that can trigger generalized anxiety in youth. But there's not like a specific subset of like, hey, if then.
Mhm. And one of the risk factors as well, I know this is about environmental conditions, but a lot of studies have shown that it can be even like a genetic thing. If people in your family have depression and anxiety, it's likely that, you know, you're predisposed to it, and therefore it's easier for you to suffer from this disorder if if and when they're life stressors.
Okay, so sorry, um, generalized anxiety disorder, it's huge. It's something that we need to deal with, and it's something that, you know, we don't shame other people for going to the doctor, so why shame them when they need to go to mental health? We need to get rid of that stigma, and we need to be advocates. You know, and the other thing is, you know, because of that stigma, people tend to suffer needlessly. And a lot of the treatments, as we said earlier, are not going to be a one size fits all. So sometimes it's going to take a little bit of patience. You know, medication doesn't always fall into place, or become effective in, you know, a day or two. Sometimes it takes a month and a half. Treatment methodology is evolving and it's changing. You know, it wasn't until relatively recently that we started adding the CBT.
Mhm. And so, in conclusion, you know, just to add on, um, Generalized anxiety disorder, there is a natural and normal amount of anxiety that someone can have, such as crossing the street. But generalized anxiety disorder can really, really impair your ability to function in every day, And so I know this wasn't on the rubric for the presentation, but the reason why I chose this topic for myself was because I personally do suffer from generalized anxiety disorder, and I also do have a comorbid diagnosis as well. And so it just really, I wanted to look more into it to actually read the research on why I take the medication that I do. I personally know what the trial and error is like as far as medication. It took me 3 medications to try one that finally worked with me. And even after doing this medication now and being on this medication, I have seen weight gain and other adverse effects. So it's really hard to either, like, do you want your mental health or do you want your physical health? And so it's something that's really challenging, and it did really impair my ability to be in grad school, to thrive in grad school and stuff. And that's why I switched from the full-time program to the part-time program. And so these are very, very serious um, disorders. I know, just because a lot of people say, "Oh, I'm anxious, I have anxiety." It's not just because it's common doesn't mean that, oh, it's just whatever. Yeah, I heard it. It's very, very, very serious. And so that's pretty much it for us. We hope that you're able to learn a little bit more about this diagnosis, and just kind of keep an eye out when you're working with your clients and stuff. But yeah, thank you guys.
Thank you.